Namaste everyone, myself Neha Gupta, student of MBBS first year. Today we are going to study about shoulder joint. Shoulder joint. First, it is a synovial joint of ball and socket variety. Its articular surface is known as glenohumeral articulation. Shoulder joint is a ball and socket joint. Since the articulation is between the head of the humerus and the glenoid cavity, it is also called as the glenohumeral articulation. Structurally, it is a weak joint and it has a great freedom of mobility, but it is at the cost of stability. Some of the stability factors are coracoacromial arc or the secondary socket for the head of humerus. Coracoacromial arch. The second is musculotendinosus cuff or the rotator cuff, which comprises of 4 sits muscles, which are supraspinatus, infraspinatus, teres minor and subscapularis. The third factor is the glenoid labrum. The glenoid labrum deepens the glenoid cavity. Stability is also provided by muscles like the long head of biceps brachii and the long head of triceps brachii. Fifth stability factor is the atmospheric pressure. Now let us see about the ligaments. The first is capsular ligament. Capsular ligament, which are superior glenohumeral ligament, inferior glenohumeral ligament and middle glenohumeral ligament. The next ligament is coracohumeral ligament. The coracohumeral ligament, which is the ligament between the coracoid process and the head of the humerus. The third ligament is transverse humeral ligament. This is the transverse humeral ligament, which is between the lesser tubercle and the greater tubercle of humerus. And the last ligament is the glenoid labrum. It covers the margin of glenoid cavity. There are 3 major bursa. The first is subacromial bursa, which is also known as subdeltoid bursa. In the diagram, it is the subacromial bursa. Second is the subscapularis bursa and infraspinatus bursa. Now let us understand this diagram, which explains the relation of shoulder joint. This is the glenoid cavity, this is the glenoid labrum. On the superior of it is the supraspinatus muscle. Then moving anti-clockwise, infraspinatus muscle, teres minor muscle and the subscapularis muscle. The anterior fibers of deltoid and the posterior fibers of deltoid are present anteriorly and posteriorly. The muscle present inferiorly is the long head of triceps brachii and 2 nerves and 1 artery called the posterior circumflex humeral artery and 1 nerve called the axillary nerve passes inferiorly. Thanks for watching. Please like and subscribe.